Tenemos que hacer algo en el mundo para que todos puedan comer los alimentos que más los nutran y verlos felices al crecer.
¡Hey! Este futuro se está escapando, en nuestras manos está la solución. Pues luchemos por los que menos tienen contra el hambre y la malnutrición. ¡Hey! ¡Hey! Por eso baila, baila, baila conmigo y siente el pum, pum, pum en tu corazón. En tus manos tienes, mi buen amigo, una mejor vida y mejor nutrición. Por eso baila, baila sonriente y siente el pum, pum, pum en tu corazón. Con mejor producción y mejor medio ambiente lograremos una buena nutrición.
En esta comunidad específicamente, no todas las mujeres tienen acceso a la educación, tanto media general o universitaria. Casi la mayoría de las mujeres llegan hasta sexto grado. Esto no nos abre las puertas para acceder a otros tipos de empleo. FAO nos ha permitido crecer a través de las diferentes capacitaciones, atenciones que hemos recibido y también fortalecer la parte de los medios de vida.
También las formaciones en cada una de las producciones que hay aquí, en cada uno de los rubros que hay. El de avícola, el de siembra, está el de pesca, que también se hizo la formación de hacer chorizos de pescado y sobre todo el de artesanía a la cual pertenezco.
Hemos recibido mucho la capacitación acá, recibimos el kit que es de siembra, de rebaño, recibimos el kit de artesanía, de electromecánico.
Que hemos sido beneficiados por la FAO y por la SER. Que el impacto ha sido grande a nivel de todos, mejorar la calidad de vida porque tienen con qué producir, hay un movimiento económico y a la gente está haciendo cada uno de sus oficios.
Represento a un oficio que es muy bonito, que es la cría de ovejos y caprinos. La mayoría son mujeres, somos ama de casa, somos esposas, somos trabajadoras, somos maestras, somos administradores. En lo que es marketing o la promoción del producto, a llevar eso, a conocer el producto.
Y hemos pensado también hacer nuestras páginas para que nos conozcan a nivel internacional, comercializar todas esas artesanías que hay, todas esas producciones pequeñas que tenemos en nuestra comunidad.
Estamos conformando una organización comunitaria de ahorro y crédito que nos permite otorgar créditos entre nosotros mismos y claro, con los recursos que nos ha otorgado la FAO y recursos propios. Esta experiencia es maravillosa porque hemos desarrollado más nuestras artesanías, nuestros rebaños, hemos adquirido nuevas experiencias. Gracias a este proyecto podemos decir que vamos a avanzar sin perder nuestra esencia como pueblo guayú.
El primer encuentro de alto nivel, Políticas Públicas para la Soberanía Alimentaria y Seguridad Alimentaria y Nutricional, se celebró en La Habana los días 23 y 24 de septiembre. Fue un espacio estratégico de diálogo político, intercambio de experiencias y construcción de sinergias entre los gobiernos de Cuba y Brasil en el ámbito de la cooperación sur-sur.
Aquí estamos defendiendo cooperación, colaboración, solidaridad. Brasil es una de las economías más importantes del mundo y Cuba es una pequeña isla. Países con esas características tienen otra cantidad de lazos que nos unen, que pueden atenuar la diferencia en población, la diferencia en tamaño, para centrarnos en lo que es verdaderamente humano, que es defender la salud, la alimentación y el bienestar de nuestro pueblo.
El encuentro reunió a ministros y autoridades de gobierno vinculados a los sectores de la salud, la agricultura, el comercio y la seguridad social de ambos países, un reflejo del compromiso político al más alto nivel con esta agenda común.
Nós queremos ampliar para maior eficiência nessa cooperação. Cooperação Brasil-Cuba, voltada para a produção de alimentos voltado para a geração de atividades de emprego, garantir as condições, não é, de cada vez mais dignidade para nossos povos.
Lo que estamos tratando acá es de organizar juntamente con el gobierno cubano, digamos, el conocimiento del conjunto de políticas públicas brasileñas y que en última análisis tiene que ver con dar mejores condiciones de vida a las capas más vulnerables de la población.
Y a partir de esas conexiones, reducir las brechas que tenemos hoy en nuestro país, poder encontrar oportunidades y trabajar de manera conjunta y poder reducir los niveles de vulnerabilidad que hoy en nuestro país crecen por diferentes factores.
A FAO, sempre como uma agência especializada de Nações Unidas em temas de alimento e agricultura, por estar aportando, registrando e ser novamente a parte terceira que estabiliza uma relação de oferta, demanda e uma parte técnica que possa operar numa plataforma bastante agressiva, mais rápida e, sobretudo, um mecanismo vertical de solidariedade e cooperação.
El primer encuentro de alto nivel definió una hoja de ruta con 14 ejes de colaboración como la agricultura familiar, la lucha contra el cambio climático y la alimentación escolar.
Tenemos un reto que es la soberanía alimentaria. Nosotros vamos a demostrar para Cuba las mejores políticas que Brasil tiene y también aprender con Cuba las mejores políticas para ello.
Tenemos la certeza de que la soberanía alimentaria de nuestros países exige la participación conjunta de todas las fuerzas, recursos y estructuras organizativas vinculadas a esta misión estratégica y decisiva para el bienestar de los pueblos.
Una vida mejor para las personas, sin dejar a nadie atrás. Durante la última conferencia regional de la FAO, celebrada en Georgetown, Guyana, los 33 Estados miembros aprobaron unánimemente 4 prioridades regionales interconectadas, que reflejan las 4 mejoras de la FAO. 4 dimensiones que contribuyen a la transformación de los sistemas agroalimentarios y que guiarán a la organización en América Latina y el Caribe hasta 2026. América Latina y el Caribe es la región más desigual, con niveles persistentes de pobreza rural que afectan desproporcionadamente a las mujeres y a los pueblos indígenas. La exposición a múltiples riesgos que aumentan rápidamente está haciendo que los sistemas agroalimentarios sean vulnerables a diferentes crisis y choques, afectando los medios de vida rurales, especialmente para la agricultura familiar. En América Latina y el Caribe, el 25% de la población se identifica como indígena o afrodescendiente, mientras que las mujeres constituyen el 36% de los trabajadores del sistema agroalimentario en el mundo. Por eso en la región, la FAO trabaja por una mejor vida, priorizando una transformación rural inclusiva a través de acciones dirigidas a acelerar la inversión y la cooperación internacional. Erradicar la pobreza rural y reducir las desigualdades es fundamental para impulsar un desarrollo económico que ofrezca oportunidades para todos. Trabajemos juntos para reducir las desigualdades para un futuro más sostenible y resiliente.
Hace 8 décadas nació una visión multilateral que transformó el compromiso global con la seguridad alimentaria. En 1945 se fundó la Organización de las Naciones Unidas para la Alimentación y la Agricultura, FAO, con el mandato de erradicar el hambre, mejorar la nutrición y promover sistemas agroalimentarios sostenibles e inclusivos. Desde entonces, la FAO ha sido un aliado técnico y estratégico para los Estados miembros, acompañando la formulación de políticas, planes y proyectos, fortaleciendo capacidades institucionales y promoviendo la cooperación internacional en favor del desarrollo agrícola y la resiliencia climática. En Venezuela, la FAO ha mantenido presencia continua durante 33 años, articulando esfuerzos con el gobierno nacional y actores locales, para avanzar en áreas clave como la seguridad alimentaria y nutricional, biodiversidad, adaptación al cambio climático, medios de vida sostenibles, igualdad de género, atención a la emergencia climática y resiliencia comunitaria. Actualmente, desde las distintas latitudes del país, como en los Andes venezolanos, productores y productoras trabajan para proteger los bosques nublados a través de la agricultura sostenible de café y cacao, buscando aumentar la productividad y fertilidad de la tierra y prevenir la deforestación para salvaguardar estos ecosistemas. En el sur de Venezuela, el compromiso con la naturaleza es un legado ancestral. En la Gran Sabana, el pueblo indígena Pemón construye sus medios de vida sostenibles a partir de una profunda armonía con su entorno. Su cosmovisión, que ve a cada elemento de la naturaleza como parte de su ser, asegura la conservación de la biodiversidad en la cuenca del río Caroní. De igual forma, en Amazonas, el territorio con mayor diversidad cultural indígena del país, los pueblos Jibi, Curripaco, Huarequena, Maniba, Jotugua Piroa, Baré y Yeral demuestran que proteger el bioma forestal es un compromiso ético fundamental, con una visión y gestión integrada del paisaje guía en la conservación de estos ecosistemas vitales para la vida. Donde la SUT del Caribe acaricia las costas venezolanas, un proyecto pionero emerge como guardián de tesoros sumergidos para preservar la vida marina, que sustenta generaciones de comunidades costeras. Esta iniciativa integra conocimientos basados en la ciencia ciudadana en 5 áreas protegidas marino-costeras del país, para protegerlas de especies exóticas invasores. La resiliencia es una de las misiones más importantes de la FAO. Cuando Venezuela ha enfrentado fenómenos climáticos y se ha puesto en riesgo los sistemas agroalimentarios y la vida de las personas, el programa de resiliencia ha actuado de la mano con las autoridades y las comunidades para brindar apoyo inmediato, mitigando el impacto de sequías e inundaciones. Pero la resiliencia no es solo responder a la crisis, es también construir un futuro. Por ello, la FAO ha contribuido con el fortalecimiento de los medios de vida locales. Además, promueve la alimentación escolar sostenible a través de la rehabilitación productiva de las escuelas técnicas agropecuarias, contribuyendo con la seguridad alimentaria y nutricional de las familias y sus comunidades. En Venezuela mantenemos la misión de transformar los sistemas agroalimentarios. Trabajamos por un país donde la producción sostenible respete el medio ambiente y garantice a toda la población una mejor nutrición para una vida mejor. 80 años de historia, 365 días de acción.
En Ciudad de Panamá se celebró el Foro Regional Sistemas Agroalimentarios Sostenibles e Inclusivos para el Empoderamiento de las Mujeres Rurales, un encuentro que reunió a gobiernos, sociedad civil, sector privado, banca de desarrollo, academia, organismos internacionales y de manera central a mujeres rurales, indígenas, afrodescendientes y jóvenes de toda América Latina y el Caribe. Durante 3 días, el foro se consolidó como un espacio multiactor de diálogo político, intercambio de experiencias y construcción de propuestas para avanzar en la igualdad de género y transformar los sistemas agroalimentarios de la región. El principal resultado fue la adopción de una hoja de ruta regional hacia 2030, con prioridades estratégicas para el empoderamiento económico, social y político de las mujeres rurales. El encuentro consolidó un compromiso esencial de todos los sectores para fortalecer el liderazgo de las mujeres rurales, con miras a hitos internacionales como el Año Internacional de la Agricultura en 2026, la 39 Conferencia Regional de la FAO, la COP30 y el Decenio Interamericano por los Derechos de las Mujeres Rurales.
¡Mujeres rurales, mujeres con derechos!
El fuego es parte de la dinámica de muchos ecosistemas y es esencial para la evolución y composición de los paisajes. La ecología del fuego se trata de la rama de la ecología que estudia el fuego como elemento de los ecosistemas y sus interrelaciones. Esta ciencia nos ayuda a entender su rol en el bosque. Para comprender el comportamiento del fuego, necesitamos observar las variables del entorno, las características de los combustibles, la topografía del sitio y las condiciones meteorológicas. Predecir cómo puede comportarse un incendio nos ayuda a planificar y prevenir. Estos elementos determinan cómo se inicia y cómo se condiciona la propagación de un incendio forestal. Un régimen de fuego ecológicamente adecuado mantiene el equilibrio del ecosistema. Su frecuencia, intensidad y estacionalidad ayudan a mantener la estructura, la composición y el funcionamiento esperado del bosque. Cuando este régimen se altera por la intervención humana, ese equilibrio se rompe y se compromete la funcionalidad o permanencia del bosque. Cuando el fuego se propaga sin planificación ni control, hablamos de incendios forestales. Estas perturbaciones pueden producir daños severos en los ecosistemas y amenazar vidas humanas. Hoy, los incendios en zonas de interfase, donde los asentamientos y actividad humana se encuentran en contacto con el bosque, provocan cada vez más catástrofes y pérdida de cobertura del bosque. El uso negligente del fuego, la expansión urbana y los diversos usos del bosque sin planificación aumentan los riesgos. Por eso es vital priorizar la prevención y la mitigación con estrategias que integren lo ecológico, lo social y lo técnico, que estén enfocadas en un cambio de conducta de la población sobre el uso del fuego y del bosque. Comprender las prácticas culturales del uso del fuego desde diversas perspectivas es una de las claves para planificar un paisaje en un contexto de crisis climática. El manejo integral del fuego es un modelo que incorpora el uso cultural del fuego, su rol en la ecología de los ecosistemas y las acciones de manejo con el objetivo de reducir el riesgo de incendios, proteger vidas, bienes y ambientes naturales. Al mismo tiempo, promueve el uso planificado y seguro del fuego como una herramienta de gestión territorial. No vamos a evitar todos los incendios forestales, pero sí podemos fortalecer las redes de gobernanza y la capacidad de autoprotección para construir paisajes y comunidades resilientes. Prevenir incendios forestales no es una acción aislada, es un proceso técnico, normativo y social que requiere planificación, conocimiento del territorio y participación de las comunidades. Este es el primer paso para consolidar una gestión integral de riesgo de incendios forestales y proteger nuestros ecosistemas, nuestras comunidades y nuestro futuro.
Necesitamos una mejor nutrición para las personas, para el planeta. Durante la última conferencia regional de la FAO, celebrada en Georgetown, Guyana, los 33 Estados miembros aprobaron unánimemente 4 prioridades regionales interconectadas que reflejan las 4 mejoras de la FAO. 4 dimensiones que contribuyen a la transformación de los sistemas agroalimentarios y que guiarán a la organización en América Latina y el Caribe hasta 2026. La región enfrenta desafíos significativos para erradicar el hambre y la malnutrición. Aunque el número de personas que sufren hambre disminuyó ligeramente en 2023, 41 millones de personas en la región aún la sufren. América Latina y el Caribe registran el costo más alto de una dieta saludable en comparación con los promedios mundiales. El estimado de $4,56 por persona por día significa que 1 de cada 4 personas no puede permitirse una dieta saludable. Por eso en la región, la FAO trabaja por una mejor nutrición, priorizando poner fin al hambre y lograr la seguridad alimentaria y la nutrición sin dejar a nadie atrás. La transición hacia dietas saludables y una mejor seguridad alimentaria para los más vulnerables es una prioridad en la región. Trabajemos juntos por la seguridad alimentaria y la nutrición para un futuro más brillante.
Para que todos puedan comer alimentos que más los nutran y verlos felices al crecer. Tenemos que hacer algo en el mundo para que todos puedan comer los alimentos que más los nutran y verlos felices al crecer.
¡Hey! Este futuro se está escapando, en nuestras manos está la solución. Pues luchemos por los que menos tienen contra el hambre y la malnutrición. ¡Hey! Por eso baila, baila, baila conmigo y siente el pum, pum, pum en tu corazón. En tus manos tienes, mi buen amigo, una mejor vida y mejor nutrición. Por eso baila, baila sonriente y siente el pum, pum, pum en tu corazón. Con Con mejor producción y mejor medio ambiente lograremos una buena nutrición.
Alimentarse es un derecho que no podemos ya postergarlo más. La humanidad nos pide de hecho que logremos esta meta superar.
Por eso baila, baila, baila conmigo y siente el pum, pum, pum en tu corazón. En tus manos tienes, mi buen amigo, una mejor vida y mejor nutrición. Por eso baila, baila sonriente y siente el pum, pum, pum en tu corazón. Con mejor producción y mejor medio ambiente lograremos una buena nutrición. Pum, pum, pum en tu corazón, pum, pum, pum en tu corazón. Estamos comprometidos a acabar con toda la malnutrición. Por eso baila, baila, baila conmigo y siente el pum, pum, pum en tu corazón. En tus manos tienes, mi buen amigo, una mejor vida y mejor nutrición. Por eso baila, baila sonriente y siente el pum, pum, pum en tu corazón. Con mejor producción y mejor medio ambiente lograremos una buena nutrición. Pum, pum, pum en tu corazón, pum, pum, pum en tu corazón, pum, pum, pum en tu corazón, pum, 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 pum.
Del 10 al 13 de octubre se realizó en Roma, en el Parque Porta di Capena, la primera exhibición global de la FAO de las semillas a los alimentos.
La Oficina de América Latina y el Caribe de la Organización de las Naciones Unidas para la Alimentación y la Agricultura encabezó el pabellón regional bajo el lema Agrobiodiversidad para la vida y los medios de subsistencia. El espacio reunió una amplia muestra de sabores, productos y saberes tradicionales que reflejaron la riqueza agrícola y cultural de la región.
La agrobiodiversidad en la región es una fuente importante no solamente de preservación de la naturaleza, pero también de medios de vida. Hay muchos agricultores, familiares, poblaciones indígenas, afrodescendientes que preservan bien la naturaleza, estos recursos y al mismo tiempo logran sostener sus medios de vida.
La muestra contó con la participación de Bolivia, Brasil, Chile, Colombia, México, Perú, Venezuela y del proyecto regional Más Algodón, quienes mostraron el potencial de sus productos y alimentos. Además, se visibilizaron iniciativas e historias de vida de los países de América Latina y el Caribe a través de una muestra audiovisual.
La FAO está ayudando a sus Estados miembros a lograr sistemas agroalimentarios y sistemas alimentarios acuáticos más sostenibles y resilientes. Esta exposición global nos ayuda a mostrar el trabajo que está realizando la FAO en los diferentes países en las diferentes regiones.
La quinoa, el amaranto, la miel, el café y el chocolate fueron parte de la exhibición, que contó con más de 50 alimentos. Varios de los productos destacados en la muestra forman parte de la iniciativa Un País, un producto prioritario, impulsado por la FAO y que promueve el desarrollo de alimentos agrícolas especiales con alto valor local y potencial global.
Hemos aprovechado esta oportunidad también para presentar estos productos de relevancia agrícola especial, que son esos que forman parte de la iniciativa Un País, un producto prioritario. De relevancia también económica para los pequeños productores y, por qué no, de relevancia nutricional para todo aquel que lo consume.
La exposición forma parte de las celebraciones por el 80 aniversario de la FAO para seguir avanzando hacia una mejor producción, una mejor nutrición, un mejor medio ambiente y una vida mejor, sin dejar a nadie atrás.
Estamos aquí en Plaza Lavalle para celebrar los 80 años de la organización y también el Día Mundial de la Alimentación. Junto con el Mercado Sabe la Tierra y también acompañando al gobierno de la Ciudad de Buenos Aires, tenemos distintos talleres, tenemos charlas acerca de qué son los alimentos, de dónde provienen, qué es eso del campo a la mesa.
Hoy acá en la Feria de Tribunales podés encontrar productores con panificados, tenemos una verdulería, están en todo el corredor frutihortícola agroecológico de la zona de La Plata, y la propuesta del Mercado Sabe la Tierra es lograr que el consumidor pueda encontrar todo lo necesario para abastecerse y los alimentos de alguna manera cobran historia. porque quienes los venden son quienes los producen.
Nosotros en Argentina trabajamos en todo el país en diferentes líneas de trabajo. La relación de las comunidades con el bosque nativo, el enfoque ecosistémico de la pesca, los mercados de abastecimiento frutícolas, cómo reducir la pérdida y desperdicios de alimentos.
Para nosotros es importante que la FAO nos convoque a este tipo de iniciativas porque en ese intercambio nosotros también podemos ver cuáles son las políticas internacionales y eso también a nosotros nos da la pauta de poder pensar, desarrollar y crear políticas alimentarias y eso va generando una mejor ayuda para los vecinos de la ciudad.
Tenemos distintos proyectos con distintas líneas de trabajo y acompañamos a los gobiernos nacionales, provinciales, a mejorar sus políticas públicas, a mejorar las técnicas hacia los productores para una alimentación mejor, para una producción mejor, para un futuro mejor para todos.
Necesitamos una mejor producción para las personas, para el planeta. Durante la última conferencia regional de la FAO celebrada en Georgetown, Guyana, los 33 Estados miembros aprobaron unánimemente 4 prioridades regionales interconectadas que reflejan las 4 mejoras de la FAO, 4 dimensiones que contribuyen a la transformación de los sistemas agroalimentarios y que guiarán a la organización en América Latina y el Caribe hasta 2026. Nuestra región aporta el 14% de la producción mundial de alimentos. Sin embargo, el 33% de las tierras cultivables están moderada y altamente degradadas, y la pérdida de más del 40% de la producción se relaciona con plagas y enfermedades. La FAO trabaja por una mejor producción en la región, priorizando una producción eficiente, inclusiva y sostenible, donde se necesita abordar integralmente las dimensiones ambiental, económica y social de la producción agropecuaria, forestal, de la pesca y de la acuicultura. Trabajemos juntos hacia una producción sostenible, sin dejar a nadie atrás.
La plataforma permite que los gobiernos, agencias, expertos y organizaciones accedan a información precisa sobre la seguridad alimentaria, la producción agrícola, la vulnerabilidad climática y muchos otros indicadores claves.
En la FAO, la salud y el bienestar de nuestros colegas son una prioridad. Por eso hemos trabajado para acercar los servicios médicos a todas y todos.
Hoy queremos contarle algunos de los logros alcanzados y sobre todo cómo estos servicios están disponibles para cada colega de la región.
En lo que va del 2025 hemos brindado en promedio 1.500 atenciones médicas y de enfermería, además de charlas y talleres con sobre 500 asistentes.
Sumado a esto, hemos realizado campañas de vacunación, charlas médicas y talleres de primer auxilio en 6 países de la región y próximamente en 3 países más.
Y hoy contamos con cobertura en Chile, Panamá, Barbados, Colombia, Perú, El Salvador, México, Brasil y Honduras, además de telemedicina para toda la región.
Nuestro programa de salud y bienestar pone a disposición diferentes apoyos médicos pensados para la vida laboral y personal de los colegas, desde consejería clínica y revisión de exámenes hasta medicina del viajero, certificados de aptitud para el trabajo y autorización de jubilación.
Además, seguimos impulsando espacios de aprendizaje y prevención, acompañamos en campañas de vacunación y estamos disponibles para responder consultas prácticas como el uso de su seguro médico.
Lo importante es que no necesitas de estar en Chile para acceder a estos servicios. Contamos con telemedicina para toda la región y un sistema de agendamiento, tanto presencial como virtual, que facilita la atención en cualquier país.
En la FAO, cuidarnos es nuestra responsabilidad compartida.
Y por eso estamos aquí, para acompañarles y apoyar su salud donde quiera que estén.
Los sistemas agroalimentarios de América Latina y el Caribe son el corazón de nuestras economías, de los medios de vida de las comunidades rurales y de la seguridad alimentaria de millones de personas. Sin embargo, la región sigue enfrentando desafíos persistentes: el aumento del precio de los alimentos, eventos climáticos extremos, la degradación de ecosistemas, conflictos y brechas en el acceso al financiamiento y la innovación. Las tendencias globales muestran que cerrar la brecha entre la oferta y la demanda de financiamiento para el desarrollo no depende solo de contar con más recursos, sino de conectarlos mejor. Para lograrlo se necesitan datos precisos, alianzas entre lo público, lo privado, la banca multilateral, la cooperación, los fondos climáticos, la inversión de impacto y la filantropía, así como herramientas innovadoras que movilicen el financiamiento de forma coordinada y efectiva. A través de su cooperación técnica, la FAO impulsa la articulación de múltiples socios para crear herramientas y enfoques innovadores que contribuyan a transformar los sistemas agroalimentarios y liberar el potencial del financiamiento.
Muy buenas tardes a todos, allí donde se encuentren.
Good morning, good afternoon, everyone. Thank you for joining the awareness, the start of the week of AMR. As you know, starting November 18th, I'm Nicholas Winter, specialist in animal health care with FAO. I'm the four-party group of World Health Organization, United Nations Program for the Environmental and for the Environment, WOAH, and there's such a necessary work as AMR. We're here to answer your questions. Upon registration, we received over 30 questions that we will try to address during this webinar. You can always write your questions in using the chat pod, and if you so wish, you can ask through hashtag resistencia antimicrobiana or in the hashtag WARW. So we will start introducing the four experts that will be answering your questions. First of all, Pilar Ramón Pardo, head of the special program of AMR with PAHO. Then Alusa Leon Kirch is an expert for the AMR group of the WOAH. Fabricio Canavero with One Health, and Andrés González Serrano, who is an officer of the One Health for FAO, Latin America, and the Caribbean. We have first a question for what we have is a main 8-question module, and then we will set the stage, and then depending on the questions arising, we will go ahead with the other questions which were sent in advance. So the first question, Pilar, The first question aims at setting the stage. Why is AMR generated? Who's responsible? Well, Nicholas, thank you. With the excellent video from FAO, that question has been already answered. Or if you were a little late, maybe some general clarifications. It is always important to understand this. Many times there's a confusion. Antibiotics, antimicrobial agent. Well, if you think of the first antibiotic, penicillin, that's the key. It's a natural substance which is to eliminate bacteria. That's an antibiotic, a natural substance eliminating bacteria. But with medicine development, this was discovered by mid-19th century. But with the energy development, new compounds and medicines, antifungi, antiviral, antiparasites, all these antimicrobial. So with resistance, to think it in a wider spectrum, we talked about antimicrobial resistance. This is a natural phenomenon, as discussed by Fleming, who discovered the penicillin. And he said that if we used the antimicrobial in the wrong way, there was a greater risk to resistance. It is really a natural phenomenon. All bacteria have a certain degree of resistance, but the factor that will worsen this is the use of antimicrobial agents, and we have to take this into account of this One Health view. That's why I'd like to thank the colleagues in the session, this wider view that we will have now. Consequences, you're already familiar with them. In the area of human health would be disease infections that used to be heal very efficiently and effectively. Now it will take longer. They will need more medications, more expensive, with more side effects. And in some cases, there will be complications, peritonitis, meningitis, among many other things. And in some cases, even death. So those are important consequences for human health. With that, I hope I've answered that question. And let's go ahead with the dialogue. Thank you. One of the big challenges which led the expansion of the three-party alliance and four-party alliance was the incorporation of environment. Fabrizio, what's the role of environment? What's the importance of environment in addressing AMR? Thank you, Nicolas, for your question. AMR, even though it's a human health program, as from the very onset, has to do with the environment. So sometimes it's difficult to find this link. But the link is when the antimicrobial used in hospitals or farms or produced in factories, they create wastes. And these wastes end up in rivers, soil, water systems without proper treatment. So there are also microorganisms, many bacteria, parasites, like Pilar just said. And these microorganisms, which are natural occurrence, may become resistant when exposed to these wastes. So all this is linked, and these microorganisms, which become resistant, will reach animals, crops, and humans, because we are in contact with the environment. So that's why protecting the environment, it's also protecting our health, animal health, and crops health. So as a community level, we need to understand that, because community also plays a role in protecting the environment. For instance, not wasting drugs into the toilet or in the garbage as a regular waste. Take that to safe collection points. That's an important way to contribute in the protection of the environment. Also, learning about the proper use, avoid self-medication, and be part of campaigns protecting these water sources or these waste receiving bodies. This is something we do not see, but we can feel the effect. So day-to-day actions by people, by communities can have a very positive effect in protecting the environment and in reducing AMR. Thank you, Fabrizio. That's a very clear answer. Remember that we are live broadcasting in Zoom and in the FAO. We're receiving questions through both platforms. We're using our X account. Also, in case you have questions. So third of all, as part of these AMR under One Health, what's the importance of food? Andres, what's the link between AMR and food and food safety? Thank you, and greetings to our other colleagues from other agencies. It's always a pleasure working with you. And from FAO, we, for a couple of minutes, would like to focus on the agri-food systems and on what they are and how they relate to AMR. Agri-food systems are those responsible for the production of food globally. They have the big responsibility of feeding now 8 billion people, and we hope that by 2050 will be 10 billion people. So this shows the pressure on these systems in order to continue to produce safe, quality, highly nutritious food items to meet the demands and requirements of world population. Clearly, these endanger the stability of the agri-food system on that of the value chains producing food, and in a way makes that this is taken the food producing capacity is taken to the limit because there is a pressure to produce at a higher rate with the stable costs. The use of antimicrobial agents in production, it's something which is widely established. But before we go into that detail, we need to say that the AMR has been estimated by the World Bank, for instance, to as having effects today equal or greater than the crisis in 2008 because of the effects on the agri-food system. For some countries, if not controlled, this effect could account for 5% of the GDP, of the agricultural GDP, and have an impact by 2050 only due to AMR up to 28 million people that may be close to extreme poverty just because of the AMR. So these proves the relevance and the importance of dealing with it and to have it as a main action point as a One Health approach. There are two main tracks of life of food quality and safety and AMR. First, wastes in amounts higher than authorized. There means an exposure for people, bacteria that are resistant to not one agent but to many agents because of the undue use of antimicrobial agents, generating tons of wastes. One specific example in the case of tomato crops, the use of wastewater, agricultural wastewater containing antibiotic waste and bacteria that already is a certain level of resistance may not be eliminated through the water treatment, which brings an alteration of the soil, and these bacteria may end up in the food we eat. So many times we are under impression that AMR, it's only related to animal food, animal protein food, but it is also directly related to fresh produce, which from the public health point of view, it's a great concern. And the second track, it's through resistant bacteria that may be present in our food and can cause diseases in consumers, which, since these bacteria are multi-resistant, in a way will be related with the therapeutical failure or the ability to treat them with the conventional or drugs and antimicrobial or antibiotics. These bacteria may be ingested through through food. Hence the importance from primary production, animal or vegetable food, all the relationship that may be related so as to avoid future resistant or reincidence of AMR. That's for now, Nicolas.
Una de las cosas que es muy interesante llamar la atención es que las
One of the things that's very interesting is that indirectly, these responses are included in different dimensions, such as Andres was talking about the environment, and that's the reflection of approaching this problem. It has to be between different sectors under the concept of One Health. That reinforces the importance of this panel of these four entities, these four bodies. For Teresa, Andres talked about the food production, which is related to a primary production. We have a strong work on the use of antimicrobials, and it is read very often that the use of antimicrobials is higher in animals than in people. What's the relationship with the generation of resistance, and any comments that you would like to do referring the use on animals for consumption?
I have to speak English because my Spanish is so poor. My English too, but I prefer to speak English. So we have much more food animals in our planet than humans. And how my colleague Andres just said, we have this expectation that the need for food will increase a lot in the next decades. And I'm from the intensive production animal sector. Poultry and swine in Brazil, we produce a lot, and not just in Brazil, but we produce a lot here. And we use antimicrobials in different ways. We use in a prophylactic way that I think there is a really great discussion about that. We use a little bit as a growth promoter. This concept is not accepted as a prudent use anymore. And in the past, we used some critical antimicrobials as a growth promoter too. Of course, nowadays we are doing better, and it is not allowed anymore. And in the last report from OA, they point out that just 7% of the countries nowadays are continuous using this kind, the antimicrobial as a growth promoter. I think we improve a lot in this subject. And but yes, we use as a in feed and in water. And I think it makes all differences between food animals and companion animals, if we can think about that. And the antimicrobial is concentrated in the gut, and the animals deliver these residues and the resistant bacteria and plasmids and so on together with manure, and manure goes to the soil and can reach the water. And yes, it's a big problem. Of course, we don't know. We are trying to discuss and to get better practices to reduce the need for antimicrobials. But in the big systems, like in Brazil, in US, in even in Chile, in Mexico, where we have a lot of intensive production, we use a lot, yes.
Gracias, Jalusa. Claramente el
Thank you.
desafío
Clearly, the challenge will be how can we do that follow-up to the use? And although the number of animals will tend to increase to respond to what Andres was saying, that's increasing demand, we hope to see the results of a relative drop on the antimicrobials. We are broadcasting on Zoom, and we received your question from X, and we invite you to type your questions on the chat or hashtag Resistencia Antimicrobiana and WAW. A question for Pilar once again, and we will go into the practical side in terms of the questions from the participants regarding what should people do to reduce the risk to the AMR? Great question, and we will answer this from the human health scope. Probably there are other answers for the other sectors, so I will leave that question. From human health scope, I refer to the popular wisdom. It's better to prevent than curing. That means we will see different actions we can take to prevent infections that will be the most efficient. Hygiene, health on your hands, good food, good diet habits, preventing the infections transmission when we have a cold or we have the flu, using the mask, distances. Once again, washing your hands frequently. That's basic to prevent infections, and that's the most efficient thing. There are some studies that show that only with these interventions, we will be able to decrease mortality load related to antimicrobial resistance with simple actions we can have in our communities to prevent. Second side, to cure. Once we have an infection, we need to take antibiotics or antimicrobials depending on the type of infections first. Prescription from the physician, from the doctor. That's very important. Always under a medical order, under a prescription. That's essential. And then follow the instructions as stated in terms of doses, time, duration. With all this, we can drop the risk of AMR. Of course, antibiotics and antimicrobial will be purchased on pharmacies with a guarantee in terms of quality that should be guaranteed in the pharmacies. Do not purchase antimicrobial or drugs out of the allocated establishments because we know that they do have the quality needed. So that will be my recommendation, Nicolas. Preventing and curing. Very easy. Thank you, Pilar. It was very clear, and it's clear that this is the first quote from the individual side, that we all have a very specific role, very clear on how in our day-to-day we can do this. And in this same relationship, there's a point where we are all food consumers. So I would like to ask Andres, what is that connection as consumers? What can we do in our daily life to mitigate the risk of AMR? Thank you. And I really enjoy Pilar's presentation because I know it is a work of 4 years that the different agencies have been doing in order to have a language that should be able to keep the technical requirements, but to adapt ourselves to any type of population, especially the civil population, which is the segment we would like to approach right now. And it is true that sometimes, because of technical terms or too much information, it's difficult to make these messages clear and precise. So Pilar has done this amazingly. And I will focus, Pilar talked about the patient side and the medical care, but now I will refer from the human beings as consumers, including the animals as animal feed consumers. So going into human consumers first, I would like to give you some numbers that show that from the food consumption or foodborne diseases, these are one of the main path of AMR that generates 600 million illnesses or cases of diseases, and out of these, 420,000 deaths per year. I will dedicate now to an area of the population which is one of the most sensitive, children under 5 years old. In this case, they are even more vulnerable, and they, in this population, suffer 40% of foodborne diseases, generating more than 120,000 deaths per year in this specific population. So these terrifying numbers are showing the importance of the work that we can do to prevent. And luckily, as Pilar said, these measurements or these guidelines from the consumption point of view to improve food safety and the quality of them are simple practices that we just need to take them into practice. I will start with them. We have 5 main ones. Keeping hygiene at the kitchen and the utensils you use for preparing your food at the moment of preparing them. So simple as separating the cooked food from the uncooked food. This is known as cross-contamination. One food that might be contaminated will affect the other, and due to heat, for instance, the concentration of bacteria could have dropped and it could increase through cross-contamination. Food should be cooked completely and following the recommendations of cooking for the specific type of food. Preservation is also important. Most of the food, natural and processed food, have recommendations in terms of preservation temperature. It's important to follow this to keep that protection that the value chain is giving us out of the studies on food safety and quality of food to the temperature that should be kept on. And finally, at the moment of having raw material for preparing food, they should be the best quality as possible. That means so basic as water that we use to prepare food and some other raw materials such as spices, some spices used for preparation of this food. It's important to respect the cold chains, and not only for transportation of food, but also some basic things such as respecting guidelines on quick freezing of food and slow thawing of the food. This process should be a slow process to prevent bacteria proliferation. And hand washing, we have heard this thanks to the COVID pandemic and the pandemic. It's been popular and it's institutionalized in the different societies. And I would like to mention something that is completely optional, but we need to mention this because it is an initiative that is stronger, which is food generated under organic conditions below or no use of AMR, of antimicrobial, within the production of the production line, which can contribute to improve the quality of them. So I repeat, this is something optional. The production costs and costs of these products are high, are not accessible to all the population, but it is an option that is winning more ground, and it is an option. And I give the floor to you, Nicolas. Thank you, and Pilar, because both of you have been clear and simple in your answer. And it's very clear, the environment, and I'm interested to know, Fabricio, not only the role that we have in our daily life in the environment and the weekends when we go out to minimize the AMR, but also addressing this from your view. What stakeholders, as well as we as people, have important roles when we think about the AMR in the environment?
Thank you for your question. Well, when we look at AMR from the environmental aspect or point of view, we see that the approach has to focus on four main sectors. One is community, which I referred to before. Avoid self-medication, avoid antimicrobials as common wastes. And these sector, which we know as municipal, which is the waste from houses, that's one of the sectors, probably the only one, which is non-productive or non-economical. And then the other or three other sectors, economic factors contributing to AMR, helping to better understand the link between AMR and the environment. First, pharma industry. It is important for drugs produced should be produced responsibly without polluting these water bodies or the soils. The waste, not only municipal waste, but also industrial wastes will reach the environment. And these may be not only antimicrobials as such, but resistant genes, for instance. And then the agricultural and livestock sector, like Andres referred to. But making a proper use of antimicrobials in animals and crops, this will help to have a lower load of wastes into the environment, avoiding excessive use and the spilling of untreated wastes. And the third sector, which is also economic sector, is healthcare, including not only hospitals, the clinics and drugstores, that should guarantee not only the proper use of antimicrobials under prescription, but also safe management of these wastes so as to avoid spilling into the environment and thus causing these resistance of microorganisms living in the environment. Thank you, Fabrizio, very clear. And here, again, it is clear it's not only best practices in the use and prevention, but also what do we do with our wastes. So it is clear how these sectors have to become involved. And again, this is a One Health approach. For Halusa, with this reference of producers and people, well, from human health, we know what to do. As consumers, we know what to do. The environment is exposed, and there are different roles. But the agriculture and livestock sector, what is the producer doing to minimize exposure to AMR?
They play a key role in this subject, and they can do a lot. But the idea is the same that my colleagues said before. They have to work hardly in prevention, and prevention includes biosecurity in the animal sector. We have to avoid new pathogens in the farms, and they need to protect the herds and the animals. They can use vaccination. When we see the reports from the countries that were able to decrease a lot the use of antimicrobials in food animals, they increase a lot the vaccination too. Of course, there are cost issues when we compare the vaccines with antimicrobials. Unfortunately, vaccines are usually more expensive, but they can do a lot of work in education too. I think we have to remember that this public have to be reached by the campaigns and by because they have to understand it very well. Of course, it depends of how they are organized. When they are organized by industry, I think we have to educate the industry too, because they make the big decisions. They can advise the producers a lot. We have to work with the associations too, because here in Brazil, I don't know very well our countries, but we have this agri-industry sector that works with in an integrated way, and for those is easier because they concentrate the rules, the practices. But in the dairy sector, for instance, or the beef sector, they don't have this connection as swine and poultry. But of course, we can figure out in what place the producers are together to have this program. And another thing that is really important is to keep records, to keep experience, to know about the results, to use the diagnosis. Sometimes we have to act quickly. We have to decide for a treatment, but we can send the samples to the lab and to know about the resistance and to change the treatment if it is necessary. And we have plenty of guidelines of prudent use nowadays in everywhere in many languages. I think we have a lot of information, but we have to work with the engagement, because I think this is the key word for the producers too. Okay, Nicholas.
Muchas gracias, Jalusa.
Thank you, Jalusa. So this is the end of the first block with 8 questions. If you have additional questions, so please use the chat pod using the hashtag. It is clear that at all dimensions and among all the stakeholders, there is a concept of best practices. And best practices have 2 main lines. First, prevention. Prevention means that there is no better antimicrobial than the one you don't use. And if there is use, this has to be rational. Now, Pilar, while we wait for other questions, I have an additional questions which are really interesting, because we talked about for consumers, we say minimize use, going to the pharmacy or drugstore, but we also know that as a natural process, we have a natural AMR. But how do I know that an antimicrobial has a low risk to generate this AMR? And with that clarity you have, can we have some sort of a magical recipe, I mean, some sort of a guideline in order to address this question? Yeah, it is a wonderful question. I mean, this is the questions we all have. How can we decrease this risk of creating resistance? And there is good news and bad news. Bad news is all antimicrobial have a certain risk of creating resistance. Good news is that there are certain degrees. So let's focus on them. What are those with the lower impact, those who will have a lower risk in generating AMR? And let's keep some things, some ideas, which I will elaborate on. Lower risk to a lower antibiotic spectrum, meaning that when antibiotics or antimicrobial is directed, has a very narrow spectrum. We focus on the microbial that we want to eliminate. That's a narrow spectrum with the lower risk because we are aiming at such antimicrobial, and other could be colonizers, part of the flora, which also has positive effects on people and the environment and animals, then they are not affected. Will only affect those with the targeted spectrum. Those are the oldest: amoxicillin, ampicillin. I mean, these names will sound familiar to many of you, and the WHO called them access antimicrobials because they have to be available to everyone. I mean, they could have throat infections and ear infections requiring those type of antimicrobials. So those access antimicrobials show the lower risk of creating AMR. First message, lower risk, lower spectrum. The second message, lower risk to better product. That is, the product that we are using, this antibiotic, this antimicrobial, should have a certain manufacturing guarantee, but in a pharmacy, in a drugstore, which is authorized to sell those products, because they are affected by moisture, temperature, storage conditions, transportation. That is, we need the product to be high quality. If not, the strength of the antibiotic will be lower, therefore will not target an antibiotic or the microbe, and now that means there will be a creation of resistance. Those are a couple of examples. And what's the other factor? Lower risk to better adherence to treatment. Treatment adherence. So we've discussed this before. That's when you take antibiotics as prescribed by public health professionals. Those are the three elements that could minimize risk. Lower spectrum, better product, and better adherence to treatment. With that, we can decrease the risk, but risk will always be there.
Clarísimo, nuevamente, muchas gracias. Ahí en el YouTube aparece una pregunta.
Thank you. In YouTube, there is a question that has to do with this global work of prioritization of antimicrobial family, such as the last for human health, such as the growth, the banning of growth promoters, but also a separation by criticality. And this is a question for Halusa. Whether in farms some progress has been made in some sort of banning or regulation of those critical categories established for according to role and relevance for human health.
The last report from WHO included fosfomycin in this group, the high priority, critically important. We don't see a lot of use of this class because it's an expensive product. And we don't see a high resistance as well. Talking about the fosfomycin, I'm not sure about each country, of course, but in general, we see low resistance for this product. If we think about colistin, yes, it is forbidden as a growth promoter, but we can use as a therapeutic, and maybe we are using in some places in a dose of the treatment and in feed and as well. Talking about the cephalosporins is the third class. Usually we use ceftofur, and ceftofur we don't use in feed or in water, what is very good because it is injectable, and in this way the pressure is lower than in feed. And yes, we have some resistance, not directly to ceftofur, but the mechanism is shared between the class to other cephalosporins. And the last one is quinolones. Quinolones, I think we have a big problems because we have the formulation for including feed and water, and injectable too. And we do have a lot of resistance in clinical isolated, as well in indicators like E. coli, enterococcus that we use as indicator of enterobacteria. And quinolone is still used, and we have a lot of resistance. I don't know if I answer well, but it's a tough question, no?
I know.
But
Gracias.
yeah,
Perfecto,
thank you.
Jalusa. Muchas gracias. Claramente,
Thank you,
hay un gran
Halusa.
desafío en esto.
Clearly, there is a great challenge here. Countries throughout national plans in the agriculture and livestock sectors, they have improved their surveillance programs. And in the coming years, with the data we are collecting and according to the national context, we will have to move forward in looking at these critical categories and to regulate that is managing the situation according to the country's realities. But we want to preserve resources in the case of human health.
Going back to the question that Pilar answered, Pilar talked about that characteristics to consider and think that we minimize the risk on human consumption. But what happens on growing animals or with pets that may suffer the generation of resistance when we use antimicrobial? What are the practices or considerations we should have when to consider a safe use of antimicrobial? Interesting question because it fits at the core of our task as veterinary doctors and animal health guarantors. And I will begin by commenting something I will elaborate on based on one of the big statements by Pilar. There's a lower risk when the quality of the drug is higher. And for this, there are some news that are not so good. In low-income countries or medium-income countries, we consider that 1 out of 10 drugs is doctored or of quality of that is a standard below what the law requires. So these drugs will not be able to address at 100% the infection in the case of antimicrobial, and they may contribute directly to AMR. So this is one of the biggest risks, but I want to focus on my answer. Some recommendations as well to minimize this risk. First of all, I always say to ask your veterinary doctor when there's any health issue and prevent self-medication with the animals as well as with people. We do not advise self-medication for either a pet or a production animal. This recommendation is the same. Then control, and as a health official role, control the product to be prescribed should be registered in the country. This should be a product that has been authorized by the health authorities, by the veterinary service of the country. And this is part of the strictness of the treatment. It begins with the vet doctor that prescribes the treatment. And then from the user standpoint, the owner of the animals, when using this drug, verify the expiration date, verify that it's not falsified, and then a antimicrobial that is not properly identified should not be administered. And if I'm not sure what I'm administering, preferably not to use it. Avoid the mixing and say, well, I don't know what this is, but I will mix it with a new one and something good will happen. No, usually we validate this fact that medication could be worse than the disease. And then it was commented for humans that you should follow the indications in terms of doses, repetitions, and duration of the treatment. One treatment is not more effective because I double the doses or I just have the duration of the treatment threefold. If the doctor said 5 days, that's what you have to do and will not be better because you expand that period of time. Then it is very important for production animals' resting time. I'm talking about dairy production, meat production. This voluntary waiting, it is part of a scientific study of when we deplete the drug in the environment or the drug will no longer be present in the product to be consumed. So the voluntary waiting times should be respected. And the more we respect it, the higher the accountability will be and our contribution to prevent this AMR. And once we administer this drug, we should do follow-up and results of the treatment. That is to say, pharmacosurveillance or reporting from the field, reporting that this drug is working out, is very important to make decisions of future treatment. If a drug is no longer working properly or if it's not following the potential at the maximum level, well, the treating vet should make decisions in terms of continuing using the same drug, testing an alternative, or something that it is advised to have bacteriological studies in the lab. And it's not possible in all cases, but we can do some randomized testings to study whether multi-resistance is at the lab level. And so we can have an impact, hopefully, in this regulating level, so we can learn out of one case. One specific case would guide us in terms of national policies or regional, international level, so they will be aligned to the optimizations of the antimicrobial use. I would like to highlight that it's always worth not forgetting prevention. Pilar said this at the beginning. Prevention, it's important. So we do not need to use drugs for treating diseases. And within part of these measures of prevention for animals, production animals, of growing animals, as well as pets, as Halusa said, it is a use of vaccines or immunization plans that will help us not to go to the end of treating, but preventing diseases through the correct use of vaccination, which is a very useful tool, powerful, and tested efficacy in terms of control of diseases, aligned to biosafety practices that will contribute to the health plans. And at the end of the day, we prevent the use of antimicrobial for the control of diseases. Thank you. Thank you. And we will take once again that we talk about good practices. We insist in these two dimensions. We need to have prevention as first pillar and the occasional use. But I would like to highlight that both of you said very important things, that it doesn't make any sense to use an antimicrobial where there's no quality and origin guarantee, although we follow a practice. It is a good practice to start by guaranteeing that what I'm purchasing, because it's either an investment for my health or the animals that I will use in this. This is what actually I'm buying. Otherwise, it would be just an expense and will not be effective if I'm not contributing to the AMR. And so I would like to highlight this pillar, which is related to trying not to just take the shortcut of buying on the street or buying products that do not have quality assurance. because after that, all our problems related to AMR. Next question is related to the environment. We were talking about the dimensions. And Fabricio, I would like to ask, you said, you talked about the human role of not dropping antimicrobial that are due in the household waste, and also at the municipal level, the industrial level, and agricultural level, the environmental view. Can you talk about specific action cases of where there have been some countries affected by this, by the how they have contained the AMR from the environmental point of view? Thank you for your question. It's very interesting because preventive measures on the environmental side, these are topics which are established technically, but countries are just starting to implement, especially having the scope of prevention and AMR. As you said at the beginning of the webinar, the environment, it is a sector that is joining into this dynamic. So it is very interesting in the region with good practices that were already part of it, but they're integrated into these national plans. Are regulations around antimicrobial recovery at the community level. Many countries have regulations in terms of disposal of these drugs. At the hospital level, it's much more strict and established, but countries such as Colombia and Brazil, that they have regulations that are very well established to protect the entry of antimicrobial in the environment, in the community sector. And this is a shared accountability between government, federal government, state, and municipal, because municipalities are the ones that have a lot of accountability when doing collection of this type of solid waste mainly. And this regulation, what it does is to set a shared accountability between the state and the producers and distributors of drugs. So in different points of the city and communities, in most cases, for instance, on pharmacies, there should be a space where the consumer can go and drop the drugs that did not use or those who are due, and the final disposal will have a shared financing between the private sector or production and the government. This helps not to have, this helps to have synergy between different government, state, community, and so this will prevent the entry of antimicrobial into the environment. So these regulations will comprise pharmacies in general, but a big part of these are antimicrobial. Very clear, Fabrizio. We're very close of the end, but we will be addressing the questions. We will not answer all of them. Unfortunately, Camilo, the technical questions, the specific questions, I would like to close with 3 questions that came up related to communication pillar. I think that's a pillar that we cannot finish without addressing it. The first question was related, and it is a general comment, regarding whether we can use different terms in terms of antimicrobial resistance and what to use. And so the answer, just to be the umbrella of this topic, is that there's evidence that there's no single way to addressing this, that where to want to communicate and having cultural aspects included. But there's a key message that we have today. One, using acronyms do not facilitate the understanding of the topic, and uses antimicrobial resistance as the best approach, by exceptions of the adaptation to the local level. Secondly, the simplicity of the messages will guarantee a better impact, and this has been seen by the experts when we need to try to be simple, not using technical terms, and this is related to the communication role. So the last 2 questions, the first for Pilar, in terms of communications from the health side, I'm very interested to know in this approach from AMR towards communication, there's a question: how can we address the primary care level of health, and how to have access from human health towards the most vulnerable collectives, such as children or the elderly in this AMR topic? Can you please talk about the vision from health, and so we can communicate these sanitary measures? As you have been very clear, communication is a challenge. Just resistance to antimicrobial. It's difficult to capture that term. It's important because somehow we're reflecting that complexity we have behind these terms. There's another term that I think is very useful for the children, for young people, that somehow they can better understand what we're referring to, because we're referring to a phenomena that makes bacteria to be resistant to all antimicrobial, that it will be superbacteria. So sometimes using this term superbacteria within an educational scope and health education that will be well understood could be an example and a way to address these communications. So it could be very useful for physicians, nurses, primary healthcare to explain patients what is happening. So that's important. And let's not forget that communications is a base for changing behaviors. We need to communicate the messages pretty well to generate these changes on behavior. And as you said, also, children are essential, young people, because they have an influence that is amazing in terms of change of behavior of society. And also, they are the future. Today, it's been proven by many studies that they are agents of change within the practices of hand washing in the family. Daddy, you didn't wash your hands before eating, or stop quitting smoking. Daddy, you're smoking. Mom, you're smoking. So it's very important to have this education, to have awareness from the youngest one, from their life. And you just mentioned the elderly, Nicolas. I believe this message is very important, and new studies are helping us focus where we have the greatest load on mortality due to resistance to antimicrobial in the elderly, because these people are fragile. They have multiple diseases, cardiovascular diseases, cancer, different chronic diseases, and they are much more susceptible to have infections due to bacteria. So let's pay attention to the elderly. We need to take care of them. They need to follow the vaccines programs, good hygiene, good food. And another piece of data just to consider the scope of the seriousness of this. It is estimated for Latin America and the Caribbean is about 360,000, 325,000 deaths related to resistance to antimicrobial. And 80,000 of them are directly caused by antimicrobial resistance. And you could say, well, it is a continent with more than 600 million people. What does that mean? That means, to have a benchmark, is that death by traffic accidents, which are important, we all know close by in our surroundings. It is estimated that for 2021, the year that we're referring to this estimation, were 310, 330,000, depending on the sources. So it's 3 times more than those who died on the traffic accident. So it's important to communicate this situation that is so serious on public health. Thank you, Nicolas. Great.
Thank you, Pilar. And from communications, we have to work on that behavioral change. And the last question is for Andres. Along the same lines, raising awareness, how do we address, we see production of food, best practice of use. How do we address, how do we reach the productive sector with these awareness on use, growing demand of food, the need of having multi-variable care. I mean, how can we communicate? What tools are there? And many of them, they may be good not only for the environment, but also for human health and animal health. What what's the communications way of addressing the AMR? Let me here offer a view on communications that even though we've never had so many tools as what we have now, the flow of fake news is growing. Not all the information shared is worth of sharing, even though we have very good tools. The bulk of communications among these big communications network, these people which are called influencers that induce self-medication, self-prescription of medicines. It's something that needs to be taken into consideration. And this is something that can worsen the situation. Again, medicine is a science that should be respected. And for that, we have trained people to recommend the use or not use of drugs, including antimicrobials. But back to the social media and how to communicate this to the population, we need to use simple messages, bearing in mind the sensitivity. We need to avoid sadnizing the industry. Everyone is trying to do their best and trying to reduce of antibiotics for as growth inducers. But even the FAO, we talked about sustainable transformation of agri-food system. There is no system transformation overnight that will keep what we need, healthy and available food for the population. So these processes need time. There's a big commitment from the private sector. We have to acknowledge that private sector, animal production, and from aquaculture, there are more and more committed to standards with the improvement of production standards or practices. And these communications should also consider how sensitive this issue is. The responsibility we have on international agencies in disseminating messages, and that's one of the first key messages. Avoid sharing information which we're not sure whether it's use of written networks or social media. The information should be corroborated, should be verified. Then we need to understand that we are here to help producers. We are here to support producers to be better and better. And the role played by the official veterinary or healthcare service is the main gate. International agencies are here to provide a neutral stage so that they can communicate their outlooks and their views. But the regulatory function is up to the health authorities. We're just here to support, help, facilitate the work of official services. Last but not least, let me refer to education campaigns, which in some countries start at the earlier ages, especially in the EU, for instance. Health education starts in the preschoolers, and not they don't have to be an expert in multi-resistance, but they can, like Pilar, they can disseminate best practices of biosafety, hand washing. I will not touch the animals. I will disinfect my shoes or will clean my shoes or will leave my shoes outside, will change my clothes when interacting with animals in the backyard. So children are more aware of these type of instructions, and that can help the challenge of adults. And with that, I would like to thank you again for the information shared by comes from the other agencies. We need to understand that it is clear we all four together are stronger, and that these efforts will help us reach better to the recipients of this information. Thank you very much. Thank you, Andres. Great answer. And with that, we'll be adjourning the webinar. I'd like to thank everyone for joining and for being part of this webinar in the AMR Awareness Week. Let me emphasize this set of messages, clear messages. There's lots to be done, regardless of the role or the stakeholder. We can do something to mitigate the risk of AMR. The challenge is how not to underestimate. We don't need a disruption in terms of what we do, but to do what we do every day a little better. And small changes, the baby steps will contribute to minimize the AMR risk from each one of the sectors and stakeholders. There are practices to improve prevention, adequate use, looking at the system to make the reality of the threat of AMR is not a reality. This webinar is one of the initiatives we have as a four-party effort. We collaborate with governments, but we collaborate with the national stakeholders. So feel free and to request information or assistance. This is our role, and we are available to take your information requests. There are lots of information available, and from our interagency, we carry on webinars and events, and we try to open the dialogue. We can also take your requests. I'd like to thank the speakers, the four representatives. These are a clear example, and not only for their collegiate participation of this joint effort, this need of addressing AMR as One Health. Recordings will be hosted in the FAO site, but you can always log into any one of the agencies where you will have information. There are lots of information, both updated information and information on future events and future meetings. Once again, thank you. Good morning, good afternoon, and we'll see you